Hello everyone, today in series of DocPlexus interviews, we have with us Dr. Dheeraj Kapoor. Welcome to DocPlexus, sir, who is a Head of Endocrinology at Artemis Hospitals, Gurgaon. So today we are having a session with him on multiple endocrine neoplasia. So sir, could you please tell us about multiple endocrine neoplasia syndromes?
Yeah, so these are very rare entities, but nonetheless physicians should know about them. Basically 4 types, the men 1, 2, 3 and 4. The men 1 is by far commoner. It is less malignant or less dangerous, shall I say, than men 2, and men 2 subtypes are men 3. Now, the men syndrome is caused by a genetic mutation, which means it is an inborn error. It is not caused due to any lifestyle changes. Many endocrine hormone glands and neoplasia growths, which may be tumorous, so cancerous or non-cancerous. So multiple tumor growths is what we call the men syndrome or the multiple endocrine neoplasia.
Okay. So sir, among the various patterns of men syndrome, which is most serious condition or complication?
So men 2 is more serious than men 1, and in that the medullary thyroid carcinoma is the most serious matter, and it is rapidly fatal, maybe even the second decade of life if not treated.
Okay. So how can this condition be managed effectively?
First of all, if a family member has it, then screening, pick up the disease at the earliest possible, and you may be surprised to know that if you treat, survival is prolonged. In a person who has a genetic mutation, remove the thyroid gland, even if not cancerous, and that prolongs. So surgical treatment is the treatment of choice in these patients, whether neoplasia has happened or not. If you find a genetic mutation, operate.
Okay. So sir, how can we screen the patients?
Screening is difficult. Genetic analysis is present in big cities in India, but genes need to be analyzed, and it's not a simple lab test that every lab is doing. So genetic analysis in the patient's siblings, the children, the first degree, which means the uncles, aunts, first cousins, that is a mandate.
Okay. So does this disease affect the quality of life in a patient?
Certainly, why not? So if you have neoplasia of, for example, the parathyroid, so the levels of calcium will be high, so symptoms of diarrhea, maybe constipation, lots of urine, all of that can cause life problems. Cancers are life threatening as well, so there can be a problem there.
Okay. Sir, any message to our DocPlexus community?
Yeah, so this has been a very wonderful conference, and talking about such rare diseases, I think we will go a long way in enlightening the physicians.
Thank you, sir. Thank you for being with us here.